this is kind of like Miriam asked me to do this topic, and I thought, you know, who cares? Who wants to hear this topic? But you're here, so obviously you do. Anyway, it's about preparing for your doctor's visit, and we'll talk a little bit about when you come into the hospital too, because Kim just told me some of the issues that she has in the hospital. But okay, so you might not recognize Dr. Miller because that's when he had hair. Okay, he's the one. He's that one. Anyway, and why I have this slide up here is because Dr. Miller's patients love him. He spends a lot of time. He talks, but the truth is, it doesn't matter. He's like every other doctor. And he thinks things happen by magic. Like when they say, oh, well, why don't you just go and get this scan and do this and do that? They think that's easy. They think it's no big deal. So like as nice as he is, like any other doctor, he doesn't really get what it's like to have to manipulate the world of Dravet or intractable epilepsy. So here's some of the things that I was reading and I found out. When you go for an appointment with the doctor, a lot of times we just go. I'm going to see my doctor. But you really should prepare. You should act like it's a business meeting. Because you want to get something out of this visit. You're going there. You have this child who has serious issues. It's your valuable time. And you want to make the best of it. You don't want to just sit there and kind of stutter and stare. So you should prepare, like it's a business meeting. Make a list. You should make a list. And if you kind of know what you're going to say, if you're prepared, you're kind of not so anxious or nervous, because some people get anxious and nervous when they're at the doctor. They think of a million things, but by the time they get there, they forget. So make a list. Write it down. Make a list. We all have iPads, iPhones, things like that to use. So, and have it prioritized. Kind of know what's important to you. So you make sure that you hit your most important points first. So it's not like you're there in the meeting and time is going on and on, and you've already talked about things that aren't that important, and by the time the visit's almost up, you didn't get a chance to see what you were really, what you really wanted to talk about. So that's it. Don't talk about things that are insignificant. Talk about what's important to you and why you're there. Okay, now, one thing that people don't take the time to think about, and it's so important, especially when you have a child that's going to need ongoing medical care, different therapies, medications. You need to understand your insurance policy. Like if you need to read it. If you have an agent, sit there and let him or her explain it to you. Because you want to know when you get a prescription for something, if it's going to be paid for. And I can tell you without hesitation that no doctor knows the cost of your medication. When you go to your doctor, and even your nurses don't know it that well either. When you go to a doctor and he gives you a prescription for Vimpat, I don't know if any of you are on Vimpat. Some people have like $600 copays. It really depends on your insurance and what it covers, what the formulary is. So it really behooves you to know your insurance policy. Like if you're going to take a job, that should be one of your decisions if you have a child with chronic illness. How good is your insurance policy? What do they pay for? What don't they pay for? And how you could get some of these things paid for. So I think that's really important too. And like I said, if you think that your doctor writes a prescription for you and thinks about how much it costs, you're delusional, And I had a thing the other day where we had a patient who came in. She had moved here from Idaho, and she had Cobra. And, sometimes Medicaid, if you have Medicaid, you don't have to worry. You don't have to pay for things. But Cobra, this woman had like this really high copays. And the residents and the hospitalists couldn't understand why she wanted to check out of the hospital so soon. It was because every day she was paying a percentage of that hospital visit. And so you have to realize that they are not trained in cost of medications, cost of testing. They don't know how much your copay is. So it really behooves you to figure it out. Okay, testing. You should never leave a scan without a copy of the disc. You know, you should just never. I mean, you have the right to have that disc. So when you're getting it, when your child's getting an MRI scan or PET scan, whatever kind of scan we're doing these days, you need to ask the technologist, tell them that you need to leave with a copy of that disc. Now, sometimes they might tell you that they can't, but they can. Then just ask to speak to their supervisor because you can leave the copy of the disc. Now, the EEG, it's a little harder because it takes them a while to download the data from the EEG. But you should have your records. You should, or your child's records. You probably should have your own records too, but we're talking about your kids. Now, what's important to your neurologist? You know, and Pilar sitting here, she's our ketogenic nurse at the hospital, and she could tell you she does a lot of the genetics clinic. There is nothing more distressing than when someone comes in with 5,000 pages of records. You know, when they're just piled up there and they're not sorted out and they just give it to you, and you're kind of trying to get through this visit, and you look through 500 pages, and maybe you find 15 pages that have any significance to you. So when you go to see a neurologist, he doesn't need every CBC your child had drawn. He doesn't really need all your prenatal records. He doesn't need all your hospital nurses' notes. What really is important is the imaging reports, any kind of imaging. They've had CAT scans, MRI scans, PET scans, the report, and the scan. They also need the EEG reports. Now, you could give them the EEG disc, but just the reports, when it comes to EEGs, the reports tend to be enough. And since this is Dravet, you need your genetic testing. Any genetic testing report. Like I said, you don't need your CBCs, you don't need, a lot of your other, blood levels that were drawn 5 years ago, but you do need to have the copies of all the genetic testing that you had, and your child's genetic testing, and if you had any parental testing, those are important things. And what they need is a good medical history. Now, I don't know how many of you get your doctor's notes and read them. Does anybody read them? Do that? A lot of times, every time you go to the doctor, they write, doing well, seizures better, this and that's not helpful. But a good medical history, if you had a good medical history. So here's what they need to know, right? That somehow, like the history, what happened? Like, this is Dravet, so that might have happened. The onset of the seizure, what happens when the seizure is occurring, how often the seizures happen, how long they last, how long they've been seizure-free, have they ever gone into status epilepticus. That's kind of part of a history that's important for the neurologist. Also, any kind of treatments that they're on. What meds they're on presently, what meds have tried and failed, and if you tried them and you stopped them, why you stopped them. Sometimes you might have stopped, they might have been on Topamax, you might have stopped them because he developed kidney stones, you might have been on Depakote and had weight gain. So whatever the reason was, or just that a lot of times it's just that it's ineffective. And any other treatments that they're on. Now, in the Dravet community particularly, cannabinoids are used more and more. There are a lot of studies going on in different communities. So that's it. But I don't know. It's kind of legal in Florida, and it's kind of not. We haven't quite defined how our legality is in this state. So we have a lot of patients that come in and they have gotten it in Colorado or California, Oregon, or wherever else, and we don't care. We don't care if you're breaking the law. That's not our problem, But we do want to know what treatments you're on. So even when we ask you what medications you're taking, what are you taking, we mean that too. We want to know everything. that you're taking. And if there are any other diagnoses, does your child have any other medical problems? Do they have asthma? Have they been diagnosed with autism, behavior disorders, ADHD? So anything else besides Dravet and seizures that they might have been diagnosed with is also an important part of it. And then we want to know about the pregnancy, the birth, the delivery. Was there any problems? How long did they stay in the hospital? These are the kind of things that we care about. I like that picture. That was a good. And then how did your child development? When did they sit up? When did they walk? When did they talk? What level do they function at? What are they, if they're in school, what grade are they in? Are there any school problems? And then we want to know about your family tree. We want to know about who else in your family has what. And let's face it, Dravet is a genetic disorder. It's kind of important to know if, your Aunt Sally had febrile seizures. If, it's important for us to get an idea of how this mutation fits into your child's life. And then we want to know the social part of it. We want to know who does your child live with? Are the parents together? Are there any other siblings? Do they go to school? Do they participate in sports? We just want to get a whole picture of who your child is and where they come from. And now, like, I know most of us have to ask if you smoke, if you drink, if you do drugs, but that's a whole other story. Okay, now there was a show on TV years ago called Dragnet, and it was about these two cops, and the guy would come in and say, "The facts, ma'am, just the facts." So, like, one thing I could tell you is do not ramble on, and I don't say this to be insulting, but sometimes parents give much too much information that has nothing to do with it. I'll tell you, the other day, I got a call and somebody had a seizure in school, and I say, well what happened? Well, he woke up this morning and he usually eats Cheerios for breakfast, but this morning he didn't want his Cheerios. So I offered him some pancakes, but he really didn't want that either. And I had to go through like a whole day of food and the truth is that once you start talking like that, you have lost your healthcare provider. You've lost them. So you really have to stick to the facts. Because it's like I said, it's that list, it's that being prepared, because if you don't stick to the facts, you'll start, it really doesn't matter what he had for breakfast unless you're going to tell me he had 3 cups of Cuban coffee, unless there's something that's really going to play into the seizures. Now, I don't say that parents don't have the ability to sometimes sense that there's something different in their child that morning. But that's all you have to say. I kind of had a feeling by the way he looked he was going to have a seizure today. But, I don't really have to know what he ate. I didn't have to know that he didn't want to color with the blue crayon. He wanted the red one instead. And parents do that a lot, and I understand. However, it's really, it kind of really interferes in our ability to really hear what you're saying. Okay. Now, the other thing is to keep a record of the seizures. And it depends on how you want to do it. There are all these kind of apps to keep count of seizures and medicines. Like, this is my epilepsy diary, and that's from epilepsy.com, and I kind of maybe have favored that because I've worked on it. But also, Seizure Tracker is a very good tool. And if you don't like electronics, you can write it down, But on the other hand, I have a problem when someone has those little diaries and there's like 20 seizures written in like a little box. So just as long as it's kind of legible. And I think these apps really help because they give you the opportunity to record the seizures. They give you an opportunity to record the meds, and they give you an opportunity to record if there was a mismed or you used a rescue drug. So it kind of gives you an opportunity to see a pattern. And you can also share this with your physician. Now, maybe not all physicians. Like all physicians aren't so tech savvy, and they can't handle it. But thank God there are a lot of younger physicians now, and they like the technology. So we have to use the technology to our advantage. Most people get most of their health information from the internet anyway. So, or their cell phone, actually, it's the truth. But so we have these technological advances that can really help us. Now, this is a seizure action plan. And again, this is from epilepsy.com. And I have a lot of stuff from epilepsy.com because my friend Patty, who's a nurse up in Boston, is the content editor, and I do a lot of work with her on different things. And this is something that we started working on, like, probably before some of you were born in this room. Not you, Pilar. Other people. But a long time ago, we started working on this when we started working with school nurses, because those were the first people who were really interested in wanting to know something about a child's seizure pattern, So I just think it's really good that you shouldn't leave your doctor's office, your visit, without one of them. You need to kind of you need to take control of the visit. Right? And so you need to kind of sit there and work out with your doctor or the nurse. I mean, it depends on what kind of, whether you go to a big clinic or a private practice and who's there. But you need to be able to sit down with somebody and come up with a plan. Like, if your child has a certain amount of seizures, that you're going to give an extra dose of medication. If they have a seizure cluster, if they have one seizure cluster, maybe you're going to give like a disintegrating tablet under their tongue. And then if they have a seizure that lasts a certain amount of time, you're going to give either rectal Valium or now there's nasal midazolam. So, but have some kind of plan. And also you could really go further on. You get sent out, say, on Keppra, and have a plan that, this is the dose you're going to go to. And then if that doesn't work, then you're going to try this drug. So just so that you have a plan. And you really should not leave the office without a plan. And you should update it with different visits. You should update your plan, and we can even, I know that Dr. Nakvi was talking, I don't know if he's next door or when, but about having an emergency plan. And, there are some kids that we give a plan to take to an ER. Because as a lot of you know, sometimes you're somewhere not home and you wind up in an ER and you're with some adult ER doctor who is just clueless and doesn't have any idea of what to do. And so he calls your neurologist who he can't get a hold of, So in some cases, especially if you have a child that has frequent seizures, it's good to have a plan you could take to the ER. Now, in ketogenic, they always have a plan to go to the ER because they have a problem when you're on the ketogenic diet, as a lot of you know, is that so many of the medications have enough carbohydrates to really, throw off your diet. So it's really important to have these things. It's important for you, and it's actually important for the doctor too. They don't really realize it because all they think about is the time it's taking them to work it out right now. But the truth is that if you have enough, because I know most of you do not like to call your physician and wait on the phone for 20 minutes while the receptionist tracks somebody down. So it's good for you and it's good for them to have a plan. Anyway, I have to tell you, so I don't really have a lot more to offer you about how to get the most out of your visit. Does anybody in the audience have something that kind of works for them with their doctors? No? God. Does anybody have any questions?